What is glaucoma? Now, glaucoma is a group of disorders of the eye in which the optic nerve gets affected, and that results in irreversible vision loss, meaning the vision that is lost in glaucoma is not going to come back. And therefore, the importance of finding this disease, which is the silent killer of the eye. It's a completely asymptomatic condition.
Hello viewers, this video is about an important eye disease called glaucoma. The whole world is celebrating World Glaucoma Week. We at Shekar Eye Hospital are also conducting Glaucoma Awareness Campaigns for the patients and as well as all the doctors also. Glaucoma is a disease of the optic nerve which causes irreversible damage to the nerves and ensuing permanent loss of vision. So it is very important to detect glaucoma and treat it early. And who all develops glaucoma and how to detect?
So what are the risk factors who are at risk for glaucoma? You have patients who are more than 40 years of age, those who have systemic conditions like diabetes, hypertension, sleep apnea, migraine, those who have a family history of glaucoma, those who wear glasses, and those who are on steroids. How do we detect glaucoma? We do a detailed ophthalmic examination. So you have one of these which we call as the slit lamp. We do a gonioscopy where we look into the angle of the eye. We look at your optic nerve. We might order a few tests for you, like the visual field test and OCT test for your nerve. We also measure your corneal thickness, and then we confirm your diagnosis, the type of glaucoma and stage of glaucoma. Then decide on the treatment of glaucoma.
Hello viewers, I am Dr. Shailesh, glaucoma specialist. In this video, I will be speaking about an interesting topic, a very important topic also, that is called glaucoma. So we all know glaucoma is the disease which affects the optic nerve, the back portion of the eye. So this is the nerve which carries all the visual signals. This nerve gets affected whenever there is change in the pressure or high rise of eye pressure and damages the nerve. So that is what is called glaucoma. This glaucoma is very peculiar in that sense that once the damage is done to the nerve, it is irreversible. We cannot get back the vision, number one. Number two, it is a silent disease. You don't have any symptoms commonly. So you will lose the vision without your own knowledge. That's why it becomes a very dangerous disease if it is not detected early or not treated. That's why we all over the world, all the eye care specialists have come together and are celebrating this World Glaucoma Week in the month of March, usually every year. This year it will be 9th to 15th of March 2025. We at Shekar Eye Hospital also are celebrating this Glaucoma Awareness Week, and we spread the information about glaucoma to all our patients and see that they get their eyes checked, and if there is any glaucoma, get detected and treated early. See, the symptoms are very less or minimal. Only in one type of glaucoma called angle closure glaucoma, where the angles of drainage is very narrow, there the pressures becomes very high and the patient present with pain, redness, sometimes blurring of vision and vomiting and all those features. So they come to the eye doctor much earlier. So those patients require immediate attention, treatment and reducing the pressure. Sometimes the laser peripheral iridotomy has to be done. But the other type of glaucoma which is quite common is called open angle glaucoma, where the symptoms are very less or there are very minimal symptoms where patient does not recognize it and they won't come to checkup. That's why getting your eyes checked at the early stage is very important. Now who are all at risk for glaucoma? So the first and foremost is the age. Above 40 years is very important. They are at the high risk of developing glaucoma. Number two, those who have family history of glaucoma. Any family member having glaucoma also has got high risk of developing glaucoma in their siblings. Number three is that those who have diabetes, high myopia, high refractive errors, they tend to have glaucomas much earlier and much severe also at times if it is not controlled. Then those who have injuries like post-trauma, so those also gets glaucoma much earlier. And the other important thing is the steroid use. Those people who use steroids for a longer period of time, unsupervised or not prescribed by the doctor, they also tend to develop glaucomas, and we see that a lot of adults use these steroids for allergies or some other condition, continue for years together and land up in glaucoma. So these are the risk factors for developing glaucoma. Now treatment part comes when you visit the hospital, because there are no symptoms, you have to visit an eye care specialist and get your eyes checked, so that we do certain tests also to detect if there is any early stage of glaucoma is there or not. And we just do your eye pressure checkup and monitor your optic nerve status, and with these things we can detect and start the treatment. Usually it will be in the form of eye drops. Only if it is not controlled, we'll go for surgical options, and in some situations where angle closures are there, then we do YAG laser peripheral iridotomy also. So with all these measures, we can keep glaucoma under control so that your eyesight is not lost. We can maintain the existing vision so that you can lead the life properly. So the World Glaucoma Week campaign we are doing, see the future clearly. That is the logo that we are using it for this year. See the future clearly so that you can enjoy the life with a disease-free glaucoma or a glaucoma controlled condition, so that you can have a good vision and live the life happily. Thank you. Please subscribe to our YouTube channel, Shekar Eye Hospital.